Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about cutting edge treatment options for shoulder pain. If you're suffering from shoulder pain and if your doctor has recommended a cortisone injection, you're going to want to watch this to make sure your shoulder pain is resolved by getting to the root cause of your problem, not just for the short term, but for the long term. A lot of great information coming up, so stay tuned. Okay, Dr. Mike, shoulder pain. Shoulder's the most complex joint out there. Personally, I've experienced the shoulder pain. This is why we do regenerative medicine in our practice 7.5 years ago. I fell skiing and partially tore my rotator cuff, had great success with the regenerative medicine injections, but we still see patients coming in where they have shoulder pain. Either their primary care or the orthopedist lines them up for a series of cortisone shots, which, we keep talking about this, it creates more damage long term. We have a lot of different treatment options in our clinic where we can actually help preserve the joint and avoid surgery in the long term. And I think there's some confusion with whether it's a partial tear, a full thickness tear, if it's retracted. So why don't we start by talking about the anatomy of the shoulder and defining the different types of tears?
Well, if we think about the shoulder, as a lot of people heard the terms, it's a ball and socket joint. There's the humeral head, which is the ball, and then there's the socket, which is the joint itself. It's a small socket. That's why we have such large range of motion of our shoulder. And the movement takes place by 4 muscles. That's the rotator cuff. People sometimes say the cup. It's not a cup, it's a cuff. They call it a CUFF. So it's 4 muscles that surround that ball and socket so we can go in all different directions. But more commonly, it's part of healthcare problems nowadays that if a person goes to their doctor and gets evaluated and it hurts when I move it and I touch it and it feels painful, you immediately get diagnosed with a bursitis or tendonitis.
Yeah.
That's just, therefore it's inflamed, let's just put a cortisone in there. So the healthcare concept is because, we as the physicians evaluating may think that it might be a partial tear, might be some inflammatory thing, but we can't rush to the MRI picture. We can't definitively see those tendons to see if there is a tear in any one of the 4 tendons. So you get diagnosed with a bursitis and tendonitis and they immediately put on cortisone. It'd be much easier to start ibuprofen, some icing, some laser, some things that are a little bit more holistic aspects, not as so dramatic, and get the body moving because we want to get range of motion for the neck as well as the shoulder and the whole concept of how did it come on in the first place.
Yeah.
We like to get to that root cause, right? Person sitting poorly at work, person's doing a lot of repetitive motions. Once you start identifying, now you say, it's still bothering the person. So we want to get the pictures of the MRI. We'll look at those MRI pictures, and when we start looking at the tendons, more common tendons tear more often, but there's layers of the tendon tissue. So you have a partial thickness tear, might be part of the tendon is torn down, maybe a surface of the tendon could be called a partial tear, or you could have part of the tendon torn, but not the whole tendon.
So
you could have it's still attached to the portion of the bone where it attaches to. So we call that a full thickness tear, but a partial width.
Yeah.
So it doesn't go across the entire tendon.
Yeah.
If it does go to the more extreme, full thickness, full width tendon tear, the person probably is not moving their shoulder very well because they're going to be very weak or not having an ability to move against the resistance when we test them. So we really want to identify those things. And most doctors who evaluate the shoulder can judge if there is a little bit more of a full thickness tear right off the bat. But most people don't have that problem. We got to work with the more common, the repetitive strain, the partial tears, the inflammatory aspects with the tear. But then the socket can get involved. You can have arthritis along with it.
Yeah.
There's a rim of cartilage called the labrum. So that small socket is helped by a rim of thick cartilage tissue to keep the ball in its place. That can get torn. So we look at all these different factors. When a person says, hey, my shoulder hurts and I can't do this or that, we want to tease that out. And when we look at a good musculoskeletal shoulder exam, we start seeing those differences to treat them, starting simple, working on some alternative aspects, holding back on cortisone, and determining where those damaged tissues are, such as the tears.
Yeah, I think the big confusion too, and we've seen recently, and I know firsthand from experience what a full thickness tear is. Essentially I always describe it as like if your tendon's a shoelace, well, my supraspinatus tendon had a hole in the middle. It still was attached, it wasn't retracted. So for strategy, and this is where it gets a little bit confusing, sometimes patients and their providers jump to the gun and say, oh, you have a tear, the regenerative medicine injections are not going to be effective. That's not true. If you have a complete tear where it's retracted, right, then you're not a candidate really for the regenerative medicine injections. If you have that, partial full thickness tear, like in my case, it was 1.6 centimeters, you're a perfect candidate, and I'm living proof. I'm going on 7.5 years with great results. And the fact that we use an amazing lab, regenerative labs down in Pensacola, Florida, does a great job in providing us with these Wharton's jelly allografts to really aid in helping the body to heal itself. And that's logically a great first step. But I think in our clinic, the benefit is that it's a multi-provider approach, utilizing medical care and certainly cutting edge medical care with the Wharton's jelly allografts and the PRP, but also chiropractic treatment, physical therapy, everything kind of coming into play to learning more about how you can actually utilize these cutting edge treatments to avoid surgery or medication, in this case cortisone, that's going to lead to surgery down the road. If you're interested in learning about our proven 7-step approach to ending shoulder pain, you definitely want to give us a call. More information can be found on our website at maragalmedical.com. A lot of great information on our YouTube channel. Please consider subscribing. Best yet, we take most insurances. Well, that's it for today. I hope you learned something, and I hope you realize that shoulder pain can actually be treated conservatively with great results. Have a great day, everyone.
Take care.